Hey, everybody, Happy New Year, and welcome to the first episode of Frank About Health for the year 2026. It is January 8th, and I am here to give you an overview, like a monologue for the next hour, about healthcare in 2026. What comes next? As all of you have remembered over the last 12 weeks, I had provided my Voices of Disruption campaign. Excuse me, Voices of Disruption campaign. That was episodes targeted with disruptors that have shown that during times of healthcare disruption, whether within our government or whether within actual technology or solutions for illnesses or treatment methodologies, they had something to say about it. They did something about it. And I am going to feature or highlight some of those episodes verbally because obviously, in a 1 hour monologue oriented show, all I want to do is provide you with the facts and show you the direction that this show is going to in the year coming. That being said, I will issue a disclaimer. If anything that is suggested or mentioned by me during the next hour is something you disagree with, please know they are not the thoughts or opinions of talkradio.nyc or of this show, Frank About Health, but rather they are researched facts, quotes from episodes that were done last year, as well as thoughts to think about, food for thought, basically. Now, we're also not trying to undermine your ongoing treatment protocols or whatever guidance that you're currently going through. We're just here to provide you additional thoughts to use in whatever personal decision making you have with your healthcare. So let us begin with what I call segment one, the year that tested the system. If you recall, when I started Frank About Health back in 2021, we were in the middle of the COVID pandemic, and I was doing my best to be targeted with specific illnesses, epilepsy, cancer, Alzheimer's disease. A lot of it was based on what I was going through at that time. I have been living most of my young adult life since the age of 16 with epilepsy. I am glad to say that it is under control with the right medications and the right treatment from my neurologist, from therapists, as well as from other advocates that I have known over the years that have been very supportive and very instrumental in giving me the types of treatment to focus on it. The reason why I was focused on the other two, cancer and Alzheimer's, is because I had spent most of that time since 2021 also advocating for my cousin, who is now today in a nursing facility, living the rest of her life with Alzheimer's disease, and for my father, who is still recovering from recurrent prostate cancer, which unfortunately, due to his age, there are treatment opportunities that he cannot really become involved in because now it's about quality of life management. So, again, I use this show and this platform to understand that when living with a condition, it's not all over. You just have to live differently, and you need to use the right nutrition and the right medicines and the right alternative treatments and just use the right information that you get hopefully from your primary care physician or your oncologist or your neurologist or whomever the particular facilitator is of your condition. So I figured the one thing I wanted to do is highlight not just the past, which would, of course, invite you into understanding why Frank About Health came to be over 165 episodes ago, but to also set the stage for all of you to learn how to take charge of your healthcare in 2026. As we go through the rest of the hour, you're going to understand why this is going to be the most entrepreneurial venture that you ever have to undertake in your own life, because even though it's not about business, it is about livelihood and sustaining your life, given that we are living, unfortunately, in a society today that loves to tout mainly misinformation, as well as skewed information that really caters to their own agenda. So that may sound critical, and frankly it is. But the thing is that I'm using it as a mechanism so that I can further advocate for the right information to pass through your ears, and you can use your own brain to make your own decisions that will benefit you and your family's lives. Now, that being said, let's look back at 2025 in a subtle way. When I mean by subtle, I'm just going to point out some key things that occurred, which would show that the way we were living our lives in this society prior to 2025, there was more structure in place. One such thing is that we all experienced in the early part of 2025, the entire state of California going through devastating forest fires that to this day, 1 year later, only 20% has been rebuilt. We're talking about displacement. We're talking about the side effects of being exposed to that fire for so many days and weeks. Who knows what's going to happen of those firefighters' health care conditions in the next 5 to 10 years? Think about the 9/11 responders. They themselves are probably increasing in mortality rates compared to the initial 3,000 victims that went down in the towers on that day. And that's because they were exposed to asbestos, they were exposed to burnt smoke, toxic air, fumes, chemicals, dust, the list goes on. Well, that obviously happens in forest fires as well. So after that happened, I was dealing with my own personal issues of having to rush my cousin in February to a nursing home because she was now wandering pretty much with part of her clothing not on her body. That would be highly inappropriate, subjecting her to possible violations that we wanted to avoid. And more importantly, she could have gotten hit by a car and not even know it. Either way, myself and my mother, as the healthcare proxy and as her next of kin representative, her aunt, we were able to have her sent into the emergency room of Columbia Presbyterian Hospital and then move her there sequentially into a nursing facility to provide hospice rehabilitative care and basically long term living. And it was a burnout session for me. I basically took a hiatus from Frank About Health between November and April because not only was I trying to recover from the ongoing caregiving of my cousin, but I was recovering from the death of my dear friend Retha Gray. So, yes, I went through grief issues. And yet, I found the way through this show and through the support of talkradio.nyc to be able to come back as a fighter and as a further developmental advocate and come up with new healthcare solutions, which I will cover later on in the show. So, in those experiences that I mentioned about Retha's passing, about my cousin going into a nursing home, and about the burnout that I was going through, I was able to look from within and pull out all of my necessary resources to manage my recovery and resiliency. That's what you do not learn in our society, in medical school, especially if you don't go to medical school. We have learned to depend on a system that was already fractured and partially improved during the COVID pandemic. But in the past year, it has been broken down into bits and pieces, and there are some parts that'll never come back. We call that healthcare disruption. So, as a result, during the first 4 months of 2025, what I found was a natural pivot from being able to get ready to launch my healthcare documentary, Being Frank for a Healthy Future, only to find out that it was going to be a longer time before that would see the light of day because unfortunately, the future wasn't looking as healthy as I had hoped. And as I was also provided information from my previous guests prior to the end of 2024. However, I was lucky to meet Mr. Marschall Runge, who had his book, The Great Healthcare Disruption, and it was written in 2024, published in 2025, when the only disruptions mentioned were the high quality vaccines, the high quality x rays, robotic surgery, new solutions for treatments and cures for cancer and AIDS and things long considered mortal or fatal. The thing is that while that still exists, what also existed was defunding those programs and also reducing a lot of the benefits that people were receiving with their existing Medicare, their existing Medicaid, their existing insurance. And if you were living with a chronic illness, you would literally have to make the choice to give up your home and keep your coverage to keep yourself alive, or to give up your insurance to stay alive as long as possible. How do you like that for moral judgments? Now, I'm not trying to preach and I'm not trying to be very political in those comments. I'm just trying to make everyone aware that in these kinds of disruptions, both personal and medical and technological, so actually all three, that's when you have to center yourself, get hold of yourself, and start to make your own decisions given what limitations exist, and also do what you can to stay clear of the misinformation that really doesn't even fit you to begin with. So I've been hoping by launching my Voices of Disruption campaign and featuring many targeted guests that I would be giving you direction from these individuals that would share with you, the viewer out there or the listener, about ideas that you may not have heard of or that you can explore further so that you can get a stronger foothold. The reason why I was in that path was because of the fact that on July 4th, 2025, the One Big Beautiful Bill Act was passed and went into law that day on July 4th. However, implementation was on January 1st, where 20 million Obamacare recipients, known as the Affordable Care Act, are no longer insured. Why? Because their insurance premiums were basically as low as $500 for your family, triple or quadruple the time for the January payment, and most people, I am sure, although I have no metrics and no data on this, probably foregone their plans or dropped them or probably had to take secondary alternatives. Or there are those that are probably well off enough to probably sustain them. But again, without that information, I can't be forthright. But I could tell you that Obamacare recipients are predominantly below the poverty level. I myself applied for it in 2023 and was declined because my income level allowed me to get Medicare Advantage. Now, Medicare Advantage is a supplement that most insurance companies in 2026 decided to drop, except the one I'm currently using, which is Aetna. This is not a commercial for Aetna. However, if you are an Aetna recipient, more than likely keep your plan. It is not being as affected by the One Big Beautiful Bill. However, I do know certain benefits of mine have been discontinued. My nutrition benefit is one of them. My mental health benefits have been restricted. And as far as my medications are concerned for epilepsy, I used to go to Canada to get them without insurance for 3 months supply, equal to about $200. Now I use generic co-paid medications, which still sustain me, but I can't go out of the country with all the tariffs and everything else. I have, however, adjusted accordingly with my budgets, my medications, my doctors, and my insurance to meet my immediate needs while continuing to advocate. We're about to take our first break. What I gave you was the introduction to the disruption that occurred in 2025. And in the next 2 to 3 segments, I'm going to show you excerpts from shows that we've done and how we tried to address those disruptions. And then I will close the show out by telling you of a new solution that I've been in the works with. So everyone, please stay tuned as I continue to reflect on 2025 and then get into what 2026 will be about with our healthcare, right here on talkradio.nyc and on our YouTube, LinkedIn, and Facebook channels. We'll be back in a few.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays, 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Hey, everybody, and welcome back. What I just showed you there was the episode with my dear friend Phyllis Quinlan, who's been co host with me on Frank About Health, not only for about 40 episodes, but definitely on those special episodes, paying tribute to Retha Gray, as well as having that very informed discussion with Dr. Marschall Runge about his book, The Great Healthcare Disruption. I just want to summarize some key points or takeaways from that show, which also is a reflection of what 2025 was about in healthcare. 2025 was a year of systemic strain, not isolated crises. Clinician burnout as a structural signal, not a personal failure. When you have clinicians no longer getting paid for their services at the rate that they were because of the insurance provided by that individual's, by that professional patient, or by that professional doctor's patient, they've had to determine, are they going to continue to take care of their health care in the high in-depth quality they've been trained to do, or if they've had to probably switch hospital systems or move to their own private practice where they can actually take in patients that will pay them at the same time, give them the quality of health care that they need. Patients itself, including myself that I mentioned earlier, were caught between innovation promises and real world access issues. When you don't have money for your health care, whether it's out of pocket or whether it's your insurance, you can't get the health care you need. They don't do it for free unless you're in a lucky situation, like I said, with those living on Medicare Advantage or possibly having some kind of pool trust program if you're in the Medicaid program or some other kinds of solutions. For me, I've been blessed that NYU Langone Health, a teaching hospital, was able to pay for all of my laboratory testing because of my alumni status with the university, as well as because I have been a chronic researcher at their Comprehensive Epilepsy Center. It does help when you are actually in the network, both academically, professionally, and in addition to being a patient. Where it doesn't help is that that only makes you part of an elite circle, and you're not able to see a concentrated healthcare program on the majority of people, especially in high urban populations like New York City. Now, we have seen in the media constant cutbacks and rollbacks, NIH defunding certain things, whether it's cancer research, whether it's immunizations, whether it is cutting SNAP benefits during the government shutdown from October to November, whether it is threatening, which they succeeded in not reestablishing, the Obama healthcare subsidies to allow people to have affordable healthcare with the Affordable Care Act. I mean, for healthcare to become a political topic rather than a human one, obviously was showing the narrative that our current administration was trying to sell us all. Now, if you're already healthy and only see the doctor once a year for a physical exam, that might be well and good. But what if you're also a caregiver for elderly parents? That is when you can see how these changes are hitting home, and they're actually hitting your pocket. And you're finding yourself making choices practically between life and death. Making sure, do you have Christmas time where you buy presents, or do you save the money so that you can pay the next month's premium? Those are the kinds of decisions I found myself making. Thankfully, with this show, Frank About Health, and with a guest such as Marschall Runge, and in addition, my dear friend Phyllis, I was able to really get the right pathways to investigate and to come up with solutions to be able to contribute my part into what I knew would be a much more severe 2026. So, with the help of Phyllis Quinlan and Marschall Runge, I developed, with the Fordham Gabelli School of Business, my Voices of Disruption campaign, which meant that I was only going to have people on this show that were experts in their field that had been through disruption and had done something about it. Obviously, Marschall Runge was one such person. Another person that I featured at some point in October was Dale Atkins. Dale Atkins is a clinical developmental psychologist mainly for children, and she wrote a book called The Turquoise Butterfly. Actually, when she wrote it, she was talking about the relationship between grandparents and their grandchildren. And it was much more developmental and ancestry related. Now, how do I say ancestry? When a grandchild, a granddaughter in this case, as part of the book, is going to the grandmother and trying to understand her sense of trust in her caregiver, which in this particular story is her grandmother, it also allows the bonding to form and create a sense of history as to where you've come from, especially in the freedom that grandparents do have with their grandchildren that most parents are probably more restricted to because they're in the role of caregiver and trainer and supporter. And they, of course, are also probably working parents at the same time. So the grandparent can come in and have some free reign into creating the understanding and history of the family legacy. And that in itself is excellent for your developmental and mental health. Now, that was basically what we were all going through, mental health challenges. A lot of people trying to understand their ancestry, understanding why, if they have a chronic illness, where is the genetic link to the cause? Or just understanding that from your support systems, how do you make sure they are the right support systems and not the transferred relationships of people that unfortunately have disserved you in any way, whether traumatically or otherwise? That is the challenge we all face every day in our lives. But when you have a good familial support system, which is implied in that book, that's why I'm bringing it out that way, you have a better sense of your own inner foundation so that when faced with healthcare crises, whatever they may be, personally or to your family or friends, you know how to think faster and think on your feet so that you're able to do what you can to continue supporting in any way that you can, as well as advocating. I'd like to say proudly that Dale Atkins was on the Today Show this past Monday, the 5th of January at 9:40 a.m. And not only did she cover this book, but thanks to the three hosts on there, including Al Roker, she was able to break down the familial lineage and the value relationships between a grandparent and their grandchild. I think in many ways what I learned from it, and that's beyond her appearance on Frank About Health, is that when you have an alliance with generations up or generations down, you feel a better sense of yourself and continuity. Because guess what? When you are a child and you become an adult and you have a spouse and children of your own, you want to continue that sharing the generational wealth and knowledge. And basically that creates the sense of mental acuity that you have when you feel connected. Most of us are living in a society today where we're fragmented because of the media and because, again, of misinformation and political infighting and a lot of discourse when we see horrible stories happening every day for what's going on in this country or other countries. And that can be very distracting, which, of course, is part of the intent, to distract us from being self-contained and self-aware. So I'm pleading with everyone in 2026, whether it's through this show, Frank About Health, or whether it's through the Conscious Consultant Hour that's on at 12 o'clock on the same day, that you get the everyday awakening that you need, that there is no way to live a healthy life unless you're aware of your own needs first and make sure that they are taken care of first. Because then when you have your health, you can provide the support that others need from you. And at the same time, try to work together to collaborate and get the results and resources. Now, there are those that unfortunately don't have that. So one big advent in 2025 was the growth of artificial intelligence, in particular AI, ChatGPT, Perplexity, and other kinds of tools that were in the experimental stages when I, in 2024, had Maury Zelkovich, the Maury method, come in and introduce the notion of AI. But we were at a point where it was now everyday use for everybody who's using social media, for using email services, for uploading and downloading photos, podcasts, anything. You can feed them into your ChatGPT and get a transcript written out. You can also ask it for advice once it has built up a history on communications of your patterns, your health patterns, your concerns, your financial, your concerns, your budgets, whatever they may be, and it's able to be your substitute friend. But here's my caveat, and I guess in essence a disclaimer. It is not a human being and therefore should not be taken at full face value. I would say that when you go ahead and have an AI chatbot that you learn to trust or that you learn to support you, especially when you're isolated or do not have the proper resources around you, you use it as a secondary resource to still find out the right pathway to get the resources that you need. That's another impetus for creating my Voices of Disruption campaign. There were other people that I had besides Dale Atkins as well as Marschall Runge. I had Matthew Zachary, who appeared on my last show before the holiday, a brain cancer survivor, an advocate that is about to perform a fundraiser in April at Lincoln Center to raise money for his political committee that is going to raise awareness for those people who are looking for the right treatments and funding for cancer care, being that that's something else that's been defunded. Simultaneously, I also had Dr. Todd Otten, who was also displaying his upcoming documentary to be released in February called Suck It Up, Buttercup, featuring a lot of medical professionals, including Matthew Zachary, as well as some high-level entrepreneurs, Mark Cuban, all looking at the necessary fundraising and development and awareness of being able to take care of the gaps that unfortunately the One Big Beautiful Bill has taken away. I think the other person that also stands out is basically Tom Ingegno, and I cannot go into the next commercial break without also mentioning Anshar Seraphim. Thanks to Anshar and Tom, they were able to help me fine-tune a lot of the necessary aspects of my Voices of Disruption campaign that's going to be leading to a potential product solution that I hope to bring out around the same time that Matthew Zachary does his concert. So overall, I would say that the second section of this podcast, after I gave you the history in section 1, I label more as AI from promise to pressure. The pressure is for me to get stuff done, but AI can get it done faster. You know, either way, the mindset to have going forward when faced with ongoing healthcare disruption, especially as things may get from bad to worse, as is being said in the media, is to grab hold of what the resources you have right now and do what you can, especially before tax season, to take a look at all the new tax credits and tax refunds we are due to receive to help self-fund your healthcare if that's what you find becomes your ultimate choice. All right, I will come back with section 3 of this episode of Frank About Health, and I will spend the next 2 sections mainly referring to 2026. Stay tuned right here on talkradio.nyc and on all of our socials, and we'll be back in a few.
Misalignment within your sales team or with a client stalls deals and creates unnecessary friction for you and the client, resulting in up to 37% lower win rate. If you're in pre-sales, sales management, or sales enablement, and you'd like to increase revenues, win rate, margins, client satisfaction, and stay competitive, this show is for you. Hi, I'm Art Fromm, host of the Making Seamless Sales Show. Please join me live Thursdays at 7 p.m. Eastern on talkradio.nyc.
Have you ever wondered what truly lies beneath the calm? I'm Jacinta Yang. Join me every Wednesday at 1 p.m. Eastern Time on Talk Radio NYC as we explore healing, self-discovery, and a space where science meets spirits to help you find peace in a busy world. Take a deep breath and tune in to Beneath the Calm, where every conversation guides you back to the calm within.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey everybody, and welcome back. In that particular commercial break, I showed you Dale Atkins' website as well as in the small box on the corner, the turquoise butterfly. Both books are available on Amazon.com, the one I mentioned with Marschall Runge, as well as The Turquoise Butterfly. But in particular, if you go to her website, you can get the book there at a lower cost. And it's definitely a must read, especially if you want to read it to your grandson or granddaughter. And you could really get a whole family gathering together when looking at the pictures and the just the content in there. It's very motivating and stimulating. I will say that probably it impacted me during the holidays. I had some real quality time with my nephew. We actually went to the planetarium together, a trip that we were planning for almost 8 months, but at least it happened during the holidays. And I noticed he has been going through his own awakenings with his health as well as with our family system. He was even there for my father and had my father reciting soliloquies from Hamlet. That just tells me, okay, my father's doing well, but when he's not engaged, you wouldn't know it. That's why it is important that the grandchildren and grandparents gather together to keep the longevity alive or keep it going, both for the new generations as well as the ones that are ultimately, I mean, that's the reality, ultimately transitioning. And here I am watching it all and being able to say that my father will be 95 years old in August. I intend to do a big 95 celebration, and I'm just doing what I can to keep his quality of life contained while I'm doing the same for my mother, and at the same time continuing to be an advocate for all of you right here on talkradio.nyc. Now, if I wanted to give you some takeaways from the last section, I had mentioned that AI's rapid move from experimental to operational was definitely coherent beginning around March or April. That's when the frequency of AI usage was becoming everyday language. Simultaneously, there was more pressure put on clinicians to adapt without guardrails, especially when legislation was passed on July 4th of the One Big Beautiful Bill. There was an increasing gap in trust between patients, providers, and healthcare systems, and where regulation lagged, and why this matters now, it didn't, we just have to be aware that none of this arrived gently. It arrived pretty much abruptly, and it created mass confusion. And I really believe that it is important to have programs like Frank About Health and books like The Great Healthcare Disruption and The Turquoise Butterfly to continue to go to and get some reinforcement in what you already know so that you don't get misled by whatever new topics are coming out. Now, again, I'm staying away from the political issues, but I can honestly say if I find myself listening to any of the cabinet discussing something on the news, I change to old episodes of The Good Times and MASH and pretty much 70s and 80s television, because that's when times are more clearer, believe it or not, in those stories rather than in the stories that are being made up. I sound very opinionated, I know, but that's essentially what I've experienced over the holiday season. And I will say gratefully that thanks to my ability to compartmentalize and work with these individuals that have been on the show before the holidays, I'm able to keep a focus going forward into 2026. The key points to be aware of is that caregiving is not just strain. It runs across families and professionals, and literally when your central nervous system is burning out, I could tell you I've had moments where I'm watching television, it's 2:30, the next minute I know it's 4:15. How did that time go? I don't remember dreaming. I don't remember closing my eyes. I don't remember drifting off. The central nervous system has more agency over us than we realize, especially when undergoing constant triggers, pressures, burnout, stress, caregiving activities. You have to make room for yourself every morning before you go ahead and start taking on anyone else's challenges, even if it's as simple as doing shopping for them. Take care of your mind, body, health, and soul before you go ahead and do any kind of advocacy for anyone, because without that, nothing gets done. And it ends up being very detrimental across the board. The other things that I want to point out is that you have to get yourself in a position where your first order of business is find out your pathway to continue to have psychological resilience and a feeling of meaning under all the strain that you're going through. You know, we all have our daily plans and daily calendars, and sometimes we plan weekly or monthly. That's no longer the option. I think that with all the challenges that we face each day with our life, our work, our health, you have to think daily, sometimes hourly. That's where you can really depend on AI to help structure, even 5 minutes just to breathe. I'm now seeking an acupuncturist. I think I'm going to need that on a regular basis. And again, thanks to some of the guests I've had on the show, I've had some referrals, I've made some calls, but I have to remember it's not something covered by insurance. So if I can't afford it, it may be a sacrifice. Again, something that I'll have to sacrifice or sacrifice something else that I need for my acupuncture. It just depends on the situation. This is the kind of thinking we all need to do. Start with your understanding of what keeps your homeostasis, your balance, before you move forward with taking care of others or even doing your day, whatever that needs to be, your job or other plans that you have. What else can I tell you about 2026? Overall, this is just January. It's only the first week in January. I think a lot of people, other than those that saw the inflated healthcare premiums on their Affordable Care Act, Obamacare bills, we're going to notice more cuts. I don't know what they're going to be. I do believe that when I saw, because I do receive as a disabled individual, SNAP, which is the food stamp program, I used to get about $129 a month. Now it's just $29 a month. Okay? It might just go away. I just don't know. But it wouldn't surprise me if it did. Simultaneously, I would pivot a little bit and start saying that when you are doing your financial budgets and when you get your tax refunds and when you get your income, your checks, all you have to do is save about 10 to 15% and put it in what I'm calling your emergency health account, not your emergency fund, because emergency fund can mean anything, like an emergency trip to Bermuda. No, we just need to make sure that you have an offset of those expenses that you anticipate, whether your medications, over the counter issues, or whatever. Those of you who know Jose Dennis, who's been on this show and also on some of the other shows with talkradio.nyc, he has shown his nutritious, rich foods for people suffering from dementia, people suffering from anemia, people suffering from other kinds of health problems. But by being a caregiver, especially for my father, he benefited in 2025 when in September of that year, the agency that pays him for the caregiving gave him an HSA account. And now he's able to pay all of his dental benefits, all of his over the counter medications and eye drops that he needs, and as well as other kinds of things that any normal HSA account would cover. So, indirectly, by being a caregiver, always look for the opportunities out there that are also going to give back to you, the caregiver. You don't want to be on the road to burnout. You want to be on the road to reciprocity. And there are programs out there that could do that. So if any of you out there are considering caregiving, I remember I was on what they called the CDPAP program. That was dropped in March of this year. No longer think of it as CDPAP. Think of it as a secondary job and get whatever healthcare benefits are coming to you. That's just a recommendation. And I could say it made Jose a very big advocate, especially in the area of nutrition. We've been talking one way or another to get him to do his own nutrition podcast. More of that to hopefully come in 2026. All right, let's see what else. I would say in section 3 of this podcast, it's all about human cost. And I'm here to provide ways of finding ways to reciprocate yourself in meeting those costs. I mentioned Jose's example. But the biggest cost of all is not financial. I've been saying it's about your mental health. So I would say if you have any room when you get your refund in March or April of this year, to start really looking, other than acupuncture, into what would be the good type of therapist that you actually that engage and work with during the coming year. There's a lot of uncertainty politically beyond healthcare in 2026. And I think for myself, an epileptic survivor, meaning that I haven't had a seizure in over 20 years, at the same time, someone who's been under heavy stress and burnout, I am easily triggered by behaviors that a normal person would not even think twice about. That means that I need to continue to self regulate. So thankfully, because of an old knee injury, I've been involved in physical therapy at the NYU Langone Rusk Institute for Rehabilitation Medicine. And just doing the physical therapy once a week gets my brain cells endorphins going. And not only is my knee better, but I feel more energetic and more focused and more enriched. I actually was thinking maybe I should go twice a week, but then I looked into my insurance and that benefit was cut too. You see, there's a constant give and take, push pull going on, especially when looking into caregiving for yourself. Again, my mantra for this section of the show is find ways every day to care for yourself first before you care for others. As far as other shows that I have done in this vein, I keep thinking to Phyllis Quinlan, my dear friend who I actually spoke to during the holiday season, because I wanted to just catch up with her and see what she has been dealing, in her profession with the big, beautiful bill. And she herself, I mean, her coaching is very, very supportive, even though she was talking with me on the phone. I may actually consider working with her as a coach in the next month because she was very helpful to me when I had launched this show 4 years ago. And I know that she is a professional of the highest order. And if you could find coaches, Evan Messman is another one that comes to my mind. Um, these are people that were also involved in my documentary. I want you to be aware that that documentary was also featured in the Dale Atkins show with a QR code. And if you are interested in watching it, you can scan it and watch it on YouTube. It's been out there for the last 3 or 4 months, but I definitely spread it around to everybody during New Year's Eve because it was my way of paying tribute to Retha. I do believe in this 1 year since her passing, she's still behind me. I feel her presence. So that's another thing to take away before we go to our fourth segment is that anyone that's been in your life, family, friend, colleague, that is no longer in your life for whatever reason, if you feel their presence, that could be the memories or that could be actual connection through that individual's spiritual side, and run with it, work with it, collaborate with it, because that way you get over the grief and you manage your life in a much more high quality way. All right, I guess that would be my last sentence before the final break. So please, everyone, stay tuned as we are looking into the healthcare predictions of 2026. I will give you more predictions from a Frank About Health perspective, as well as what I am hearing in the news, in addition to what I am thinking of in terms of future episodes of Frank About Health. All right, we'll be back in a few. On Frank About Health, we're not just talking healthcare. We're managing disruption and innovation. Over the last 4 years, I've taken you from epilepsy and COVID to mental health, caregiving, and now the front lines of healthcare transformation. Stay tuned for a healthier future as we bring on the innovators, professionals, storytellers, and advocates who show you how to own your healthcare every Thursday at 5 p.m. Eastern Time on talkradio.nyc.
Are you a purpose-driven individual looking for deeper healing, clarity, and growth? Welcome to the Expansion Room, a transformative space for purpose-driven individuals. I'm Siobhan Larice, host, licensed therapist, and coach. Join me every Wednesday at 5 p.m. Eastern Time on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc, now broadcasting 24 hours a day.
Hey, everybody, and welcome back. These are the signals to watch out for in 2026. You need to look at trust as your central currency of healthcare. I have always, throughout my life, defined trust in terms of your time, your money, and the type of relationships you have, professional, personal, and otherwise. We all have a budget to live with, to pay our expenses, and to earn our income. At the same time, time is our infinite currency if it's managed effectively. However, we don't live on an island. We don't have time and money and define that as trust unless you trust yourself. But then you need to extend yourself out to others, to work with them, to have personal family relationships with them, and to also have a better sense of how to create boundaries and connect, because that's what we're here for. We're wired to connect. All right, that being said, being that we're under a disruption modality now where resources that we need are being cut and we have limited budgets based on different financial concerns and commitments that we all have, you have to make sure that the people that are in your life can measure up to your standards of what's considered trustworthy. It's a challenge because we're constantly operating in a vacuum of individuals providing misinformation, not providing consistency, flip-flopping on decisions made in our government in particular. We don't have anything to model on. When I was speaking to Phyllis over the weekend, she said that what she's learned in her life is you stay local and you stay centric into your community, into your work, into your family, and try to at least build an ecosystem of trust that you can transfer out to the community at large. Again, it's a constant challenge, but when you have that strong sense of trust, a continued peace, even when faced with challenges, you can go with that gut reaction and think hopefully more clearly. There's going to be more challenges in 2026. There's a lot of question of ethics and how the government is going to cut off even more resources. I received a letter. I can say this personally as part of what to be aware of in 2026. But I received a letter that my parents' Medicaid fund is being moved over to a new organization called Anthem. Anthem is part of the Blue Cross Blue Shield family, or maybe they were and they spun off. I'm not exactly sure. Now, that may be good and that may be bad. You got to trust your instincts based on maybe you were a participant with Anthem at one job you may have had, or maybe you have found out that Anthem is cutting costs in response to the big, beautiful bill. And therefore, once the existing solution goes under the Anthem brand, does that mean that the benefits under the existing solution also get cut? Or do they get expanded? So no one's ever going to tell you unless you go through the transition and watch the result, or unless you go out there and research extensively. Because when they give you a letter that says as of February 28th, 2026, that is when they move over to Anthem, you really have between the date of the letter, which in this case was January 7th, till that February date to determine if you're going to switch over or find a new plan. So there's going to be constant decision making that we all need to make during the first 2 months of 2026 to be able to take our existing healthcare protections, our existing pharmacy protections, mental health protections, or whatever other protections you have, and determine what do you keep, what do you let go, or what do you transition from or to. That actual brain power must be investigated, just like when you're putting all of your receipts together to start filing your taxes. By the way, doing my social responsibility here, the first day of filing income taxes for 2025 tax year is Monday, which I believe is the 26th of January. Electronic filing predominantly. I think they have let go of paper filing starting this year. As far as healthcare deductions are concerned, people are going to be getting, if you're a senior, a special $6,000 tax credit. I don't know if that's $6,000 married filing jointly, or if that's $6,000 per person on a joint return, or I don't know. That's something you'd have to ask your paid tax preparer. But I also do know someone like myself who is a caregiver is subject to earned income credits and a lot of medical deductions, more than I could swallow. Additionally, the standard deduction, which used to be about if you were an individual, which is me, I would probably be deducting 12 or 13,000, but I always itemize because of my healthcare expenses. And I think my itemized amounts would be 30,000 total with premiums and other things that is not covered. But now everyone under the income level of 150,000 is going to be faced with an immediate 40,000 SALT deduction on your itemized return, while simultaneously it's about, I think, 20,000 or no, 30,000 for your standard deduction. Most people won't have to itemize. However, that could be a trick and a trap, especially if you benefit from itemizing. So again, consult with your tax preparer. I'm bringing in taxes into healthcare for 2026 because the tax law has changed dramatically after the One Big Beautiful bill was passed. This is our government's way of paying you back for the lost health coverage that you're now going to be faced with, because your refund may actually be the substitute for those healthcare payments that might come due. All right. That being said, you also remember that media and advocacy are very important tools that you have to be aware of in terms of finding the right information on your healthcare. That means be aware of what is misinformed media and what is regular media. Podcasting, it depends on who is your host. I like to be as frank as possible and as ethical as possible. I may sometimes give misinformation based on not being a licensed psychologist, even if I have a neuropsych degree. However, I'm constantly researching online and consulting with various people at the hospital systems and caregiver groups that I belong to. So I am as informed as I can be. But the thing is that I will always make sure that the information I provide is as thorough as possible. And if it's not, then I don't mention it. And that's why I issue disclaimers at the beginning of every show. So be aware of your media, social media, regular traditional media, as well as any media and podcasts that you yourself might be generating. Make sure your information out there is vetted. Okay, simultaneously, like my friend Jennifer Griggs had said on this show several times in the past, always lead in the healthcare space and with your family with a sense of dignity, but especially dignity in yourself, but at the same time, using forgiveness to make sure that if someone is not understanding what you're saying because they're too overwhelmed and burnt out to process what you're saying, expect it, understand it, accept it, take the hits yourself when you feel frustrated that what you're saying is not being heard, but at least as long as you're aware of it, you use it to maintain dignity within yourself and within the family. Overall, this is going to be a challenging 2026. And again, without being too political, we have a midterm election coming up at the end of the year. It is important that we change our congressional legislatures to put some kind of controls on whatever is happening at the executive branch level. Right now, we're running without guardrails. The guardrails are the ones that you make for yourself. And that is why in this particular show, I wanted to do a tribute to the past, warnings for the future, and say that we can get through 2026 as long as you hold on to your own healthcare first and be aware of the truth before you go and tout information out to anyone that might need the information. But it's already been anchored down by these various authors that have been on the show: Dale Atkins, Marschall Runge, and a book that I picked up at my dentist's office, Food for Health and Healing. This is a good book to pick the foods that you need to make for people suffering from the conditions my father has been suffering from. I mentioned anemia, some side effects of dementia. Thank goodness it's not Alzheimer's disease. But then also it helps with people who have been going through burnout, need iron in your system and in your brain, and a lot of electrolyte water. One bottle, 60-ounce bottle, is basically more than 8 glasses a day. If you can guzzle that down in the entire day, you're meeting all of your necessary hydration needs. I see that we are 3 minutes to ending. For those people who are into pop culture, I'm wearing gray today because today is the second half of season 22 of Grey's Anatomy. I hear it's going to be a very moving episode. The reason why I love that show is because it gives me its own version of medical school. Yet, it is overly dramatized. I realize that. But I have learned a lot. And as I've said on the show before, Grey's Anatomy and MASH have been two shows that motivated me to launch Frank About Health back in 2016 and in 2021. Oh, what else can I tell you? Well, I guess this is the moment when I say that people know that I was involved in an invention that I called MedCash. That stands for Community Action for Secure Health. It used to be for another S acronym, but due to our current environment, calling it Secure Health is much more appropriate. I am hoping that in the next few months, I will launch that product through social media, through this podcast, as well as through other channels to be able to provide supplemental financial support for people suffering from not having their health care anymore. All right, that's basically the end of this show. I've done my part over the last 4.5 years of being able to show where the disruptions were. I may not have said it as eloquently as I could have, but I wanted to fit it in the hour to point out that I'm also doing something about it. So next week, I will have a new guest, but they will no longer be part of my Voices of Disruption campaign because I'm at the point where I will be implementing the solutions throughout the rest of this year. Thank you again, Jesse, behind the scenes for engineering this show. A solo show that I think I did okay. You can give me a thumbs up or a thumbs down. It's your call. But I'd like to thank again Sam Leibowitz for all of his support throughout the last over 4 years, as well as Emily Schulman and all the other people that have been on this show and will come back at later dates in 2026. All right, everybody, again, Happy New Year, and see you all next week.